Pacho. Do you read me?
Be advised, you are coming in weak and unreadable.
Say again, Com Tower. This is Pacho. Do you read me?
Pacho, this is Com Tower. I read you Lima Charlie.
Com Tower, Com Tower. Request permission to launch and commence the field op. Over.
Stand by. Pacho, permission granted. I say again, permission granted.
Roger that. Launching podcast in 3, 2. You are now entering the field op with your host, Pacho Correa, Chief Warrant Officer 3, United States Marine Corps retired. Get some. Hurrah! Hurrah! Get some. What's going on, everybody? Another week down, another week doing the show. Hey, before we get started, I just want to let you know that my thoughts, opinions, or even my guests' thoughts and opinions don't necessarily sometimes will line up with Sitch Radio or Airtable or any other internet providers and podcast providers that we utilize to stream this platform. This is open speech, freedom of speech, Second Amendment, all that good stuff. So you also have the show, if you don't agree with what we say, to move on and listen to something else, and that's okay. But another announcement is that the show will most likely be moving the time frame here in about 2 weeks. We'll figure that out. We'll let you know ahead of time. All right. So, but with that being said, my guest today is Dr. Yvonne Jackson. She's a Navy veteran, and she does a lot of great work when it comes to mental health and therapy and counseling, so on and so forth. I myself, I'm one of her clients. So we're gonna go ahead and bring her on because she's got a lot of good information. Doc, how are you today?
Hi, I love the intro. That's pretty cool. I was listening to that. I'm like, okay, that's nice.
Yeah.
I'm doing great.
We got to give a shout out to Brian Colburn. He's the guy who runs Stitch Radio, and he's the one who came up with his mastermind idea. So, But thanks, I appreciate it.
Yeah, it's nice. It's like it lets you know that something exciting is about to happen when you hear
That's right. So, get some.
Yes, I love it.
So, Doc, why don't you tell us a little bit about yourself, who you are, did you serve in the service, all that good stuff.
Okay, I was in the Navy for a short time, and I have a family history of military. My grandfather, my father, my husband. So just a history, and myself. So just kind of have an understanding of military life. And that's about it. I am a marriage and family therapist, and I deal with lots of veterans. 80% of my clientele are veterans.
Oh, wow. Yeah. And I'm just like I said at the beginning of the intro of the show is I myself, I'm one of your patients who, go through therapy, working through, some of the stuff that, the baggage that we bring, not only from our, prior to our military service, but also, the things that we were exposed during combat and so on and so forth. So, which is, what we're going to be talking about, today, but let me ask you something, Doc. First of all, thanks for your service, by the way, and to your husband as well. I know he's a veteran himself, and hopefully we'll bring him in the show. But how important is mental health and mental well-being?
Okay, mental health, just like physical health, is just as important, even more. The mental health does affect your physical health. So I think it's number one to be mentally healthy. Because if your mind is right, even though you're physically have a physical disability, let's say you have a broken leg or whatever, and you're supposed to exercise. Mentally, if you're not there, you're not going to move. And so It's really important that the mind, and we can't underestimate the mind.
Right. And, studies have shown that, the mind and body are connected, and our body at times cannot tell, whether it's real or not real, in the sense that, the example that I've used in the past is, how is it is where you're seeing a movie or somebody, get sick, and then you're like, oh my god, because they got sick, you start kind of gagging. That's your body reacting to that at the same time. So they're both connected, and you're right, it's very important. If I'm not okay up here,
Mm-hmm.
chances are I'm not going to get off that couch
Mm-hmm.
to go exercise. Is that am I right?
Mm-hmm.
Yeah.
Or even people thinking that they're anxious, they're overly anxious, so automatically some people go to the ER because they think they're having a heart attack, and there's nothing wrong with the heart, but the mind is telling them there's something wrong with you, there's something wrong with you, and so next thing you know, they wind up in the emergency department, and they're like, there's nothing wrong with you, but their mind convinced them that they're having a heart attack, when they're
Oh
really not.
yes.
Yeah.
No, and I can attest to that. I've been, unfortunately, when I've had my episodes,
Mm-hmm.
because I am diagnosed with PTSD
Mm-hmm.
and anxiety and depression. So I've been there before, where my mind, it's, oh my god, it hurts here, my heart palpitations, this, that. Next thing you just ruminate and involved in this
Mm-hmm.
cyclone of thought process that, before you know it, yeah, you're at the ER, and then and it's funny because they start triaging you. It's like, okay, how's your mental health? Have you been sleeping? All these other things. And at the end, obviously nothing was wrong, but they're like, hey, you should contact your VA provider, so on and so forth. Follow up with them, as well as your regular doctor as well. So
Mm-hmm.
yes, 100%. Yeah, it's really important. Now, in your line of work, you said that 80% of your clients are either service members or prior service or veterans, like myself. Um, how much, I guess, across the plane, is PTSD the common denominator in that?
PTSD is the number one. Yes. Yes.
Okay.
Even the ones
And
that are not veteran, PTSD is high. I see a lot of trauma. Yes.
and I guess, what are some of the factors that led, or some of the behaviors that they show that, I guess, put them in front of you, um, for them to seek out and get help.
Well, one is difficulty sleeping,
Okay.
nightmares because of the dreams, the nightmares just plague them that they can't sleep. Hypervigilance, they're always looking around, they're always watching they're making sure, am I safe? Depression, which depression, anger. There's a lot of anger. Well, anger is a secondary emotion to depression. So a lot of times they may not have
Oh
the
wow.
depression, but they have the anger. And it's like, I'm
Okay.
always angry. I don't know why I'm always angry. But it's a secondary emotion to depression. So when I hear anger, I see depression. So that goes there. Um, let's see what else. Just startled, easily startled. Sometimes they get
Yes.
easily startled. And then the thoughts, the rumination, the thoughts, all, constantly. Um, Anytime, especially the holidays, 4th of July, um, New Year's Eve, when fireworks are going off, hearing those
Hmm.
things, the anxiety, the panic, the fear, the worry comes up. Yeah.
Yes. And all, I, unfortunately, all those things that you have mentioned, as well as, I know for me, anniversaries too, certain buddies or platoon mates or Marines,
Mhm.
that were under my care, that unfortunately, they died in the line of duty. All those things, all those play a factor, on, that gets you, I guess, in that path, or
Mhm.
that, hurricane, so to speak, where it just kind of gets you in that pattern where, all those things together, I guess, make for a perfect storm. And then next thing you know, you're already in that vicious cycle that you can't seem to get out. And unfortunately, those of us who don't seek out the help,
Mhm.
we start, seeking out, risky behavior. Am I correct?
I call it self-medicating. Okay.
Okay.
Because
Oh.
If it's using drugs or alcohol, or I need to do something to numb the memories, to numb the thoughts. And so if they're on drugs or alcohol, it's a numbing effect. I know the Vietnam veterans, when they came back, they talked about Vietnam and how they're strung out on drugs and all that. But mainly it's self-medicating. They have to stop the thoughts. They have to stop the bad drinks. They have to go somewhere else. So they self-medicate to go somewhere else. And it's in the form of, we have any addictive behavior: shopping, drinking, meeting up with different people. Some people use exercise and they're at the gym all day long. So any type of self-medication that's going to distract them from the thoughts.
Wow. I never thought about it, excuse me, when I would say risky behavior, everything that's also, alcohol, drugs, multiple partners,
Mm-hmm.
so all those things, but didn't even think of the other things like, overly going to the gym, or, submerging yourself in your career.
Mm-hmm.
I did that. Oh man, I was really good at that. Marine Corps first,
Mm-hmm.
whatever, family second, or
Mm-hmm.
even as a civilian, 100%. And it just,
Mm-hmm.
it all, but in the end, it all catches up to you some way, somehow. And at some point in time, we need to deal with that beast, so to
Mm-hmm.
speak. And so, when you, with your experience, when you've seen, when you're dealing with a service member, what are some of the, I guess, if you give some examples of extreme examples, that what got that individual already in front of you? Have you dealt with, in that most extreme cases? What are some of the things that have led those individuals to, I guess, to be in front of your desk?
Well, a lot of times I'm told that a family member said, if you don't go get help, and especially a spouse, if you don't go get help, or it's over, or if you don't go get help, we don't want you to come around anymore, if you because something is wrong with you. And a lot of times with the service member or the veteran, they think they're crazy, they're going crazy. I'm going crazy, I'm going crazy. And it's not. It's just it's this PTSD. And it is something that will be around for a long time, but learning those skills to manage it and live with it, so that the family, and then also teaching the family. But a lot of times they're in front of me because the family, someone gave them, this ultimatum: you need to go, because, or if not, then this is what's going to happen.
Yeah. I know one thing that, obviously, depending on who's, that if those individuals are too close to the situation, one, like in my case, I didn't think I had a problem.
Mm-hmm.
You'll see in, a senior staff NCO, or that leader
Mm-hmm.
chewing somebody else out,
Mm-hmm.
um, getting on that soldier Marine's face, and you're just thinking, okay, well, they're being counseled, right?
Mm-hmm.
But if you see that, that senior leader flipping a desk or anything like that,
Mm-hmm.
thinking back, it's like, oh wow, shit, there was what was going on inside that leader's mind.
Mm-hmm.
But sometimes, the environment, we just kind of like nurture, and I guess, we enable that behavior as well as the PTSD, because we don't want to admit it. Is the bottom line. And for somebody to point it out to you, oh, you need help. It's like, I don't need help. Who are you to tell me you need help?
Mm-hmm.
So, you
And
know,
getting help is not a bad thing. And one of the great things about being in the year of 2022, which is 2022 now, in this era, is that PTSD is recognized. When I was growing up, and when I look back now, my dad had PTSD. He was in the military, and he had his own. From the East Coast, and he was in the basement. He always wanted to be by himself. He was either angry or he wanted to be by himself. And it was like, well, what's wrong? Why don't you want to be? But he just kind of, and then he would play his music, and he passed away in 2016. But he played his music and he made his moonshine, and he would sit there with the music blasting in his own space. And when I look back now, he was self-medicating.
oh wow,
He had the depression, he had PTSD, but back then, In the 60s and the 70s, we didn't talk about that. You didn't know about that. Do you know what I mean?
Right.
You didn't
Yeah.
know.
No.
It's just like, well, what's wrong with dad? You know, and now I look back and say, wow, my dad had PTSD, but he was never treated for it because nobody didn't. We didn't know.
Now I know you're looking at it, from the logical and doctorate side of you saying, oh yeah, he had this. Did you ever feel growing up? Did you ever feel like, hey, what is wrong with my dad? Why is he like this? Did you ever ask those questions to yourself?
I asked those questions to myself and everybody else. Like it was 5 kids, and even my mom. Everybody avoided him. Okay, but I just kind of sit close enough to just watch him because what's wrong with him? I thought, well, maybe he's lonely. I don't know. You just kind of like as a kid, you don't know. You just like he's
Right.
different. Yeah.
Yeah, and I know I have my daughter on the show, and we kind of talked about a little bit, but we've also talked in the past. It's, and I explained to her, hey, I hope that because I do avoidance or self-medicate. My thing was just I would shut down, go internal, and I would just wouldn't talk. But it was hard to express. You think that you're protecting, and I think, and hopefully I can understand your dad, and well, you're a veteran yourself, is in the sense that we think we're protecting
Family.
our family members from just the stuff that's in here, or even the things that we saw and were exposed to, because those are some serious demons. I know it is for me, that just sharing, sharing that information, it's, I felt like, well, shit, I don't want to scare you.
Right.
And also we just don't want to, feel judged as well, like, especially in the eyes of my kids, and that, because I mean they're my everything. So um, and I'm sure, those are some of the things that, is this the common trend? I guess, I guess we're having a therapy session right now. Shit.
But for the veterans, it's not you signed, and I'm a veteran myself. You signed up to serve your country, and
Right.
part of it, and one of the things they don't tell you, you go in, you're programmed. Believe it or not, you're programmed for a certain mission, and but they don't tell you when the mission happens, what may happen to your brain in that process. And when you leave that place, because you're programmed for a certain mission, and then okay, now you're back in the regular civilization, there's no reprogramming or unprogramming. Is you're stuck with this program. And so even though you say I think I'm trying to help my family, at the same time, there was a price to pay. I mean, not that it was a bad price. I mean, being in the military, someone needs to protect the country and do that. And so if it can be looked at as it's a part of the service, and now I'm getting help because now they help veterans. They have so many things for veterans today. That's why I said it's wonderful that we're in 2022 because there's so many different things. There's mental health. There's so many things that they're trying to do to help the veteran. And so it's a service. You provided a service. Does that make sense?
No, and no, 100%. And some of the things that you said earlier, with your father, and even when in your time in the service, and along with mine, I mean, you didn't. The last thing you wanted to say, especially if you were a senior enlisted officer, the last thing you want to say is, "I need to go talk to somebody." That was a huge no. Because you could potentially get X yourself out of a promotion, out of the next position. You just didn't want to do that, and even in the first stages, in our first deployments coming back from Iraq and such, there was no debriefs, there was no decompression. So you just carry all that weight with you, and I think they've gotten better. I have next time I speak to somebody who's still in, I know I'll ask, but do you think, and I know you've worked close with the VA. Do you think, in your own opinion, that the system it has gotten better as far as providing sources for some people to, especially these guys coming back from combat, to get that stuff out of them?
I think the system, a lot of them, like you said, there's a fear of saying it within the military. You're there, they do the debriefing, but there's a fear. And so one of the wonderful things, there's different organizations, is like community care, there's a soldiers project, there's Cornerstone, there's different programs that they have in place for the veterans to be seen outside of the VA, so they do have that freedom to speak. Because I do get, I didn't want to say anything here, but I was feeling this way. So there's a freedom to do those things. So it's
Yes.
gotten better because they offer the outside sources.
Yes, and and also for anybody that's listening out there, if they're still serving, you can. One thing that how I kind of started dipping my foot a little bit before I had my my, I guess, my breakdown, so to speak, right before I retired, was military one source. You get 12 sessions for free. The military has nothing to do with it. And they can start seeing you. I was seeing providers out throughout I was living in the Temecula area at the time. So
Right.
Now, what are some of the things that we can start doing to kind of self-help in the interim before we decide to take that next step to, hey, you know what, I'm really going to go see somebody. But what are some of, I guess, self-help recommendations that you have for those of us who want to start helping ourselves, I guess?
And one of the things, if you have a support system, it's really good to have a support system where you feel safe, where you can talk to someone. And so even if it's a family member, it's always important to let your family member know, hey, what's going on with you? Because sometimes I get a lot of family that doesn't know what's wrong with them. I get spouses in and say, and I explain what PTSD is and all the information about it. Because if you have a support person, that's really helpful if somebody's in your corner and they understand you're not crazy. This is what you're going through right now. So the best thing is enlist help from your support person, your spouse, your mom, your sibling. I was in the military, and this is what I was going through. And right now with the VA on the website, they have a brochure that the family can download to see what PTSD is about. So having that person that's not judging them is huge, because they know what's going on and they know what to expect. So just first, I would say just getting that support person to give them that understanding. So when they are having a bad day, that person knows, and then communicating what they think they need. Okay. And then some self-help stuff. We talked about exercising, not over exercising, not spending all day in the gym, but going for a walk when you feel a certain way. And again, like I said, with the support person, I'm feeling this way right now. I'm going to be by myself, so that the family member is not giving them a hard time for being off by themselves.
And that was going to be my next follow-up question. And what are the things that family members can do to assist that individual in the process while they're, I guess, still deciding, man, should I go to the VA? Should I go seek mental health? So what are some of the things that they can do to facilitate those things?
Okay, be knowledgeable about PTSD. Like I said, there's brochures for the family on the site. Encourage the service member to go see someone. It's really important. And let them know you're not crazy. It's just part of the programming. And you just kind of need help with the programming that you have to function in society. So I just say encourage them gently to
There
go.
you go.
Yeah, no yelling, just gently. Yeah, I want to help you. Yeah, and just kind of, and the family member, another thing to help is just get as much knowledge as possible. Like I invite family members into session to do psychoeducation on PTSD so that they can help the member. And so if they wanted to do that, if they said, okay, before they get in there, maybe the family can go get some psychoeducation of what PTSD is about and what to expect and what it looks like and all the different symptoms that the member may have. That education is huge.
Okay. No, and those are sound advice. What are your thoughts on, as far as medication and in the treatment of individuals who I guess with trauma, let's just say trauma as a whole, because PTSD can come in many different, but with trauma as a whole, what are your thoughts, with medication and mental health treatment and such?
Okay, so with anything, there's no one size fit all. Okay.
Right.
Some people do need medication.
Okay.
Okay. And some people don't. And so depending on the severity and the amount of dreams or nightmares or the level of anxiety or panic or depression, depending on the individual and what they're going through, they may need medication. And so then they would just have to meet with their doctor and kind of go through, these are some things. And some people don't have as many dreams or nightmares or anxiety. So it depends on what the person's going through if they need medication.
Yeah. And, I myself have been on that, and the recipient of that. And it's still, and it's one thing that a lot of us, and just like you said, technology, education, information being so, readily available, a lot of us now are concerned, okay, well, what are the long-term effects of me taking this, or what are the side effects, so on and so forth. And so, somebody once told me, is that, hey, look, it's not a marriage. Having that clear communication with your medical provider, so that way, because there is, unfortunately, it's not 100%, science in the sense that, because we're still learning a lot about the brain, even to this lane. Heck, we just learned, about, you know, physics and how it actually connects, with the brain and the body and the heart and so on and so forth. I mean, those are recent discoveries. So, so it's still, and it's basically like they're still experimenting on you. Oh, this didn't work. Well, here, let me try this other pill. Maybe, but just having that clear communication, because and you're right, it's not a marriage, because like you said, what worked for one individual, there's not a band-aid, okay, this is going to work for everybody. Right.
And some psychotropics, some antidepressants may take 4 weeks to kick in, and some people 3 to 4 weeks. So it's like, if it's not working after a certain time, and there's a lot of drugs out there for depression or anxiety. It's just like you said, having that relationship with your doctor to say, hey, it's been 4 weeks and I don't feel any different. Maybe the doctor needs to change it to something else, or change the dose, or do something like that. So if you're on any type of medication, communication with the doctor is key to make sure. And then after a while, some people's system, they build a tolerance and it doesn't work anymore. So you need to go back to the doctor and get something different. Again, that communication with the doctor.
Yeah. And what can you tell to, I guess, transitioning service members who still have not gotten help, you know, but, I guess, what advice would you give them so that way they're able to get treated by the VA, because, I mean, these things may come back, maybe not right now, but 2, 3, 4 years from now.
So your question is, what advice do I give them? Stay connected. Because I know one of the things with the VA, when they connect with the VA, if they haven't been there for a physical or something in, I think it's a year or maybe 2 years, then they're kind of dropped. They need to stay connected. And even if they do go see someone, they get into mental health, keep a connection. Usually, like when I'm seeing a veteran, I get like, actually they change it. Usually it's 6 months to a year authorization. And even if you're okay, so you still have that authorization time, go see the therapist once a month or every 6 weeks. So you don't have to do it, just to do a check-in. Check in. Okay, I'm doing okay, but let me check in once a month, just to make sure you are still okay. And then if things are coming up, then maybe that needs to be increased. But keep that connection.
Yes. And another thing that I would also suggest, in my case, my symptoms, and I guess you could say a breakdown or whatever it is, my cup got full, a year right before I got out. So I was able to seek help. And luckily I had a great, boss, the commanding officer of 11th Marines at the time, Steve Leszewski. He said, hey, you have a blank check with me, go get the help, go get better. but getting that stuff documented
Mm-hmm.
in your books, in your medical books, I think it's also very, very important. So that way, along with not just the mental health, but anything else, because that's going to help you with your claim, as
Mm-hmm.
well as, being able to provide, therapy with such great providers like yourselves. I mean, as I'm going to you for cognitive behavioral therapy. What are your thoughts on, as a matter of fact, what are your thoughts on CBT therapy, and what are the success, what are some of the successes you've seen with folks, even like myself?
Well, what's as a person thinks, so are they. So let's challenge the thoughts. So I think it's great that here's the thought, write it down. What do you say? So it does work. If you kind of all the therapy works if you work it. If you don't work it, it's
There
not
you
going to
go.
work.
Right.
So you have to work it. And there is no magic wand in therapy. We wave the wand and you're done. You have to do the work. And
Yes.
CBT, you have to do the work.
And you say, and exactly, and it's not say, hey, you got to drink the Kool-Aid, but you got to drink the Kool-Aid.
You have to do Kool-Aid, yeah.
Well, in the sense that you have to, if you want it to work, you got to commit yourself, not just go in there reluctantly. Yes, ma'am. Write it down.
Yes.
Yes, and you're right. I know for me that challenging those ruminating thoughts when I see myself, going in that path.
Mhm.
One of the things that you suggested or told me,
Mhm.
hey, challenge the thought, put it on for judgment, and
Mhm.
well, is this true? It's how is this? So on and so. And the more I did that,
Mhm.
the more I changed the software.
Mhm.
To some degree, and not to say that I'm
Mhm.
100%.
Mhm.
The one has. I mean, you're
Mhm.
still waving the one. I know I'm still a work in process, but I just want to take a quick pause. I think Belinda McCurdy, she says, Violet says, "Hi, Nana." Just wanted just wanted to pass that on to you as well as Mr. Warner Cortez. Yeah. There's some of the viewers that are logging in to see the show. But
Okay.
Doc, let me ask you something. Is because we're kind of running in short for time, but
Uh-huh.
um, what quick thing, advice for those who are sitting who are still on the fence about getting help. What would you say to them?
Good help. It's not. I mean, with a good therapist. I mean, sure, there's a lot of good therapists out there, but the best thing to do is get help. Find some place where you can just let it all out.
Right.
Someplace safe. So get
Yeah.
help.
And that also is just like meds. That's not a
Mm-hmm.
marriage as well. If you don't get that vibe,
Mm-hmm.
or it's not working out, you can always say, hey, it's not you, but it is you. I need to see somebody else, right?
Right. I always ask when I first meet someone, I think I asked you too, do you think this is a good fit? Because if either one of us feel like it's not a good fit, you're not going to get better.
That's true. Doc, is it right if we bring you back on the show, down the road? I'd like to dive deep into different, subjects as far as PTSD goes.
That's
Is
sure.
that okay?
Yes, that's okay. Yes, it is.
Well, first of all, I just want to say thanks for your time, Doc. I know you're a very busy person, and thanks for your service, not only to me, but what you do for the community. We really appreciate it. So thanks so much for your time, and we'll definitely bring you back.
Okay. Thank you for having me.
You're welcome. Oh, my pleasure. Hey, everybody. Well, that's all the time for today. I just want to give a quick shout out as well to my buddy Wes. He just popped into the show. But listen, if you're on the fence about getting help, and you find yourself ruminating and going into that dark path, please reach out to somebody, support group. Reach out to us in the show. I will give you a call. But please don't become a statistic and take that next step, because somebody out there loves you. Somebody out there is going to miss you. You do matter. So please reach out. With that being said, hey, I just want to say Semper Fi. We're going to index here and get some. Hurrah! I'm out.